Good morning, everyone, and to our instructor, Ma'am Mary Abigail Paulan. Today, we are going to discuss about Health Information System of Secondary Health Unit. On behalf of my group mates, I am May Antoinette T. Mendoza, delivering you hottest and latest news of the hour. So we were tasked to do some interview about the health info in an institution, and we chose the Medina Hospital found in Tanganragot Street, South Poblacion, Medina, Misamis, Oriental. The secondary healthcare level is where most people end up when they have a medical condition to deal with that can't be handled at the primary care level. Moreover, they are more specialized and focuses in terms of helping patients who are struggling with complex health conditions. The purpose of this interview is to have a quick overview about the general information on what the secondary healthcare unit consists of, their different jobs in the unit, the setup of their organizational structure, and their role in the healthcare unit within the system, and to the community they serve.
So we have two administrators. They are Dr. Suchan, the NMMC Medical Center Chief, Dr. Moreno, the Designated Chief Hospital, Dr. Talines, the Supervising Doctor. So the location of our hospital is at Angan, North Poblacion, Medina, Misamis, Oriental. So I am Hyacinth Mejorada from Tambagan, Medina, Misamis, Oriental. Our chief pharmacist is Joanne Sulisarta. Telephone number, you can contact us 088-854-6201. So, Medina Hospital awarded for being the third cleanest hospital in Region 10. In the previous years, the healthcare unit successfully accomplished the total renovation for the building to accommodate more patients, and the human resources had also increased to have an effective staff workforce to serve the population.
Are there any issues of the hospital?
No. So our total personnel, we have 64. We have 6 doctors. We have no dentists.
The total number of medical technologists.
We have 4.
Total number of medical laboratory technicians.
1.
Total number of nurses.
35.
About total number of nutritionists.
None.
Midwives.
11.
The healthcare unit.
59.
Total population of the barangay.
38,600.
For the schematic diagram of the healthcare unit, together with the line of responsibility per job category, we can see that Medina Hospital has its chief of hospital. And under that administration of the chiefs are 5 categories per job, namely the nursing service, which consists of mostly the unit's nurses, the medical service, which has 3 subcategories, and that is the clinical, ancillary, and allied health team, the hospital operations, and patient support service, divided into 3, namely the finance, general service, and the integrated hospital information management system, or IHIMS. And lastly is the integrated hospital operations management program and quality management system.
Can you compute for the health personnel ratio versus the total population?
So 4 is to 57 personnel is to 38,000 people, or in every one healthcare staff there is 666 patients per bed. So for the doctors, they carefully examine patients to give and identify exact diagnosis and treat those health conditions and disease. Medical technologists, they perform in a laboratory setting and performs accurate tests for body fluids and collaborate with laboratory supervisions or physicians. Medical laboratory technician, they also performs laboratory testing, provide information for patient diagnosis, and collaborates with medical technologists. Nurses, they maintain daily reports to their patients while planning, implementing, and evaluating nursing care regarding to their patients' health recovery progress. Midwives, they help assist especially in laboring women. Security guards or utility, In this hospital, the guards and utility caretakers are done by one person, and he or she monitors and look after the unit for 24/7. For the administrator in this hospital organizes and provides administration support to the healthcare unit as well as supervise health services and daily activities of the hospital.
Are there job items for medical technologists or medical laboratory technicians? If yes, what are the tasks of MTs in a BHC?
Yes, the healthcare unit has both medical technologists and medical laboratory technicians in the laboratory setting. The tasks of both medical technologists and medical laboratory technician both provides tests from the patient's body fluids. The laboratory technician is under the supervision of MEDTECHS in performing tests while the medical technologist analyzes the data from the patient's body fluids and collaborate with physicians for the results. In addition, they maintain and collaborate lab apparatus and equipment according to prescribed techniques, as well as checking the proper functioning of lab equipments and report problems. So the tests are CBC with platelet count, urinalysis, fecalysis, blood typing, pregnancy test, Hepa B antigen test, Hepa A, IgM, IgG test, dengue test, and random blood sugar.
For additional questions about healthcare system and the role of healthcare unit, how do the healthcare unit prepare or take immediate actions when an unexpected pandemic such as COVID-19 happens?
We help educate the population to always follow the health protocols mandated by the IATF and supervised by the government. And as a healthcare worker, we are always prepared whenever unexpected scenarios will occur.
What are the challenges faced by the healthcare unit since the COVID-19 started?
Since the pandemic started, we struggled in terms of lack of equipment for our personal protection. In addition, the patient's dishonesty also terrifies us. Moreover, restlessness and fatigue also challenge the healthcare staffs.
Last question. To reach the primary purpose of a healthcare unit, what are the things that needs to be improved?
More facilities to be expanded in the hospital to accommodate numerous patients and to improve the necessary equipment for the quality of service by the workers.
Thank you so much for participating in this interview, ma'am.
You're welcome, ma'am.